So আমরা এই ভিডিওতে ডিসকাশন করব how to approach a patient with acute monoarthritis. So that's our target, approach to a patient with acute monoarthritis. Let's pick a good color. So acute monoarthritis. আমাদের অ্যাপ্রোচটা হবে, first of all, we will set the differential diagnosis, then we will set the points for history, then we set the point for clinical exam, and then we will consider the investigation approach. So what are the differential diagnoses of acute monoarthritis? The number one differential diagnosis would be a septic arthritis. Number two will be gouty arthritis. Number three will be a pseudogout. Number four, this could be a traumatic arthritis, so due to trauma. This could also be hemarthrosis. Then the seronegatives could present as acute monoarthritis, such as reactive arthritis, such as psoriatic arthritis, such as Angst-Pond. And additionally, there could be enteropathic arthritis. Among the infections, we can think about TB and osteomyelitis due to other causes, including TB. And in children, osteomyelitis and leukemia may present as acute monoarthritis, especially in children. Osteomyelitis and leukemia may present as acute monoarthritis. So there are many other differential diagnoses, but let's set on those mainly. So history. In case of septic arthritis, the main history will be a history of fever and history of any previous infection. For gout, there could be history of binge drinking, alcoholism, or any acute illness, such as dehydration or surgery, etc., or any precipitating drug that may cause hyperuricemia and gout, just thiazide diuretics or loop diuretics. For pseudogout, there could be history of features of hypercalcemia or features of hemochromatosis. Trauma, there will be history of trauma. Hemarthrosis, that means there could be a history of any bleeding disorder, such as hemophilia. For reactive arthritis, there could be a sexual exposure history or history of dysuria. For psoriatic arthritis, there would be history of skin lesion, skin disease, and nail changes. For Angst-Pond, there will be history of low back pain. For enteropathic arthritis, there could be history of a bloody diarrhea. So those are the most important histories to look for. For TB, there will be history of low-grade fever and weight loss. So low-grade fever, weight loss, and cough and hemoptysis. For osteomyelitis, there could be history of previous infection and severe pain. For leukemia, there could be history of pallor, bleeding, and fever. So those are the classic history points to look for in those differential diagnoses. Let's change the color to bluish. Yeah. For septic arthritis, if we examine the joint will be very tender. So very tender to touch, very warm, erythematous, and swollen, tender, warm, and erythematous. And that's actually also present in septic gouty arthritis also. In case of hemarthrosis and patients with bleeding disorder, we can find evidence of bleeding in other sites, such as bleeding into muscle. In reactive arthritis, what we find, we can find eye features such as conjunctivitis or uveitis. We can find the other skin features such as keratoderma, blennorhizicum. We can find circinate balanitis. For psoriasis, we will find typical skin changes, which are the erythematous rash with silvery white scales. We will find the nail changes, such as features such as onycholysis, wild drop sign, pitting, subungual hyperkeratosis. For Angst-Pond, we'll find that there will be Schobert test positive. The patient will also have a tenderness in a sacroiliac joint, and we can find evidence of pulmonary fibrosis and aortic regurgitation. For enteropathic arthritis, there could be abdominal mass or any fistula. For TB, we can find evidence of pulmonary tuberculosis or Pott's disease, such as tenderness over the spine, tenderness and gibbous over the spine. For leukemia, we'll find that the patient has pallor or anemia. The patient may also have bony tenderness. The patient can have lymphadenopathy and hepatosplenomegaly, along with purpura or petechiae. Okay, so those are the history points, and then followed by the examination or clinical points. Now let's talk about the investigations. What are the most important investigation? Number one, before that, let me change the color again. Investigation. The number one investigation will be the joint fluid aspiration and study. And what are the studies we will do? We'll do the cytology, we'll do the microbiology, and we'll do specialized microscopy. So cytology, the cell count, if the cell count is more than 50,000, that usually indicates septic arthritis, and then the differential for this is gouty arthritis. Microbiology, we'll do the gram stain and we'll do the CS. Microscopy, you have to do the polarized microscopy, and if the polarized microscopy shows needle shape negatively birefringent crystal, that means the patient has gout. And if the patient has rhomboid shape, positively birefringent crystal, that goes in favor of pseudogout. So this is the first investigation. Next, we will do the CBC with ESR, which usually shows neutropenia and high ESR. We can also do blood culture, which will be positive in patients with septic arthritis and may also be positive in patients with osteomyelitis also. We can do a clotting screen. We can do a clotting screen such as BT, PT, and APTT, which will be abnormal in patients with bleeding disorders such as hemophilia and von Willebrand disease. Next, we can do an X-ray of the joint. And this might show features of septic arthritis and other features, such as in case of pseudogout, it will show calcification of the cartilage. In case of gout, it might show a punched out lesion, or in case of septic arthritis, there can be joint destruction, especially in advanced septic arthritis. We can also do other investigations according to our differential diagnosis, such as we can do an X-ray of the SI joint and X-ray of the overall the spine. So X-ray SI joint might show inflammation or sacroiliitis in patients with seronegative arthritis, such as those one. And we can also do an HLA-B27, which is an additional evidence of a seronegative arthritis. For tuberculosis, what you can do, we can do an MT, you can do a chest X-ray and a sputum AFB and gene expert. For leukemia, we can do a peripheral blood film and then the bone marrow study. That's done especially in children. And yeah, those are the investigations that are essential for evaluation of a patient with monoarthritis, acute monoarthritis.